Today we have to talk on the radiographic signs on chest X-ray in pulmonary embolism. This is very important because by just looking at the chest X-ray in a patient who is having a high index of suspicion of pulmonary embolism, it's very easy to make the diagnosis. And the second thing is, by excluding all these abnormalities which may be seen in pulmonary embolism, you can think about the alternative diagnosis, or you can think about that this patient is probably having pulmonary embolism if the clinical suspicion is high, but still the patient's radiography is normal because the dyspnea is not explained by other abnormalities or other clinical problems. So there are a number of radiographic features which may be seen in patients of pulmonary embolism, and they are very easy to understand and memorize. I have made the diagram before the presentation to make it important, to make it interesting and memorable for all you people. So the first thing which can be seen in pulmonary embolism on radiography, either all these or combination may be seen. But the first, I have drawn the focal oligemia. If the vessel is blocked in certain area, the blood flow to a particular part of the parenchyma of the lung is blocked. Of course, that parenchyma is divided or is receiving insufficient blood. So if the blood is not supplied well to that particular part appears slightly more blacker as compared to the similar part on the opposite side, the comparable side. For example, if the patient artery is blocked here, if it is blocked here, the blood supply is not sufficient in this area, so this area appears more blacker as compared to this area which is comparable on the opposite side. So this focal oligemia, reduced blood flow to a particular area because of the pulmonary embolism, this area or this sign is actually called the Westermarck sign. Westermarck sign. More blood supply, less blood supply. The second important radiographic feature, which is called the wedge-shaped opacity. A pleural-based wedge-shaped opacity may be appreciable in a patient with pulmonary embolism, and this actually represents the infarction. So this wedge-shaped opacity may be appreciable in pulmonary embolism, and this is called the Hampton Hump sign. Hampton Hump sign. The third abnormality which can be appreciable in patients of acute pulmonary embolism is actually the dilatation of the right descending pulmonary artery. Remember, the dilatation of the right descending pulmonary artery. This is dilated. The right descending pulmonary artery is dilated in acute pulmonary embolism, which is called the Pulmonary sign. Pulmonary sign. The fourth abnormality which can be appreciable, but this is very difficult to determine because this is actually called the Flichner sign. The Flichner sign states that the patient right main pulmonary artery. This is the pulmonary trunk, this is the left main pulmonary artery, this is the right pulmonary artery. So the main trunk of the pulmonary artery is dilated. It's very difficult to appreciate because this lies in the mediastinum, which is already opaque. So the dilatation of the vessel is very difficult to appreciate in that case. But the right descending pulmonary artery, because it traverses through some part of the lung parenchyma and is occupied by the lung parenchyma from behind, giving a black background, so this dilatation can be appreciable. It's very difficult. So the Flichner sign, the right main pulmonary trunk is dilated, which is called the Flichner sign. The Flichner sign. Flichner sign. Another sign which can be appreciable on the chest X-ray in case of pulmonary embolism is actually the atelectasis. So there is actually a linear atelectasis in pulmonary embolism, like that appear just like white lines. They are often seen in the bases. So linear atelectasis can be seen in pulmonary embolism. That is another radiographic feature. The patient may have small pleural effusion on one or the other side in pulmonary embolism, and this pleural effusion or slight blunting of the CP angle is seen in 50% of the cases of pulmonary embolism. 50% of the cases may present with CP angle blunting in case of pulmonary embolism. The last sign, which is not specific to the pulmonary embolism, apart from these, all are non-specific because that can be seen in other conditions as well. This is actually the elaboration of this sign. So this is actually an opacity. So any type of opacity can be seen in pulmonary embolism. Not like this is a classical Hampton hump, but any type of opacity can be seen in case of pulmonary embolism. Look at this, like these opacities, these dense opacities may be seen in pulmonary embolism. So dealing with pulmonary embolism, the chest X-ray may be very helpful in the diagnosis and consequently the management of pulmonary embolism if we just look and have understanding of the chest X-ray abnormalities in pulmonary embolism. Thank you very much.